What's up everyone? Welcome to another OmniFocus Fitness video. Today we will be talking about the cardiac conduction system as well as the electrocardiogram and how those relate to the anatomy of the heart in a single pulse of the heart. So we have a particular heartbeat that beats a certain number of times within a minute. Well, we're going to examine how the heart beats in a single beat. What mechanisms happen for it to be able to do that. So we're going to go step by step. We're going to be talking a lot of anatomy. We're going to be talking a lot of neural conduction, and we're going to be combining both of those in a perspective to be able to then look at an electrocardiogram and be able to determine, like if you were to watch the show House, for example, and they use an electrocardiogram, you'll be able to look at that as well and be able to tell them at which point the heart is in terms of its beat, of its singular beat. So, without further ado, let's go ahead and get started, shall we? Let's go!
You crazy mother!
Okay, so first things first, of course, let's spit out some definitions. What is the cardiac conduction system? Well, let's keep things pretty simple right now. The cardiac conduction system is basically just a neural impulse that gets released to then get the heart to beat. So it's a neural impulse that acts on the muscles of the heart. And what's really unique, what's really cool about it is that it is independent of the brain. So while the brain plays a massive functioning role, with the central nervous system to then act on the peripheral nervous system and get us to move around, so I can move my hands, I can move my legs, I can move my head, etc., because of the brain, the heart doesn't need that. It actually has its own isolated electrical system and its own electrical neural system. That is really cool, in my opinion at least. So that's what the electrical conduction system is, and we will go into further detail in a bit. Moving on. The electrocardiogram. Alright, the electrocardiogram is otherwise known as the EKG or the ECG. Are they different? No, they are not. They are the same thing. Now, just as a fun fact, you might be wondering why they would call it the EKG when it's an electrocardiogram with a C and instead of an ECG. I typically use ECG, but EKG came around because the inventor of the electrocardiogram was a Dutch inventor, and in Dutch, the word cardio starts with K, or at least that's how I understand it, but I'm pretty sure that's accurate. So, what is it exactly? Well, it's a system of measurement of two different attributes of the heart. So, it looks at the heart and it measures the rate of the heartbeat as well as the quality of the heartbeat. So that's all it does. It's extremely important, but that is what it does in its function. And that's all you need to know for now. So, we shall move on. Let's go. Okay, the anatomy of the heart. We're not going to go into terrible detail with this because this would be an entire video in itself, but we will go over the basics. Now, I'm not going to go over the basics by just talking about it because it would be better if you had a visual. As such, we will be switching to the blackboard method, and that being the case, you're not going to see my face anymore. We're going to go ahead and dive right into the specifics. So, let's go ahead and do that. Okay, so I'm not certain if I've mentioned this already, but we're not going to be going into any sort of extreme detail with this. We're just going to look at the foundational pieces that make up the heart. So we're not going to go into like which part has deoxygenated blood or oxygenated blood, or where the blood's going to the lungs or body or anything like that. We're just going to talk about different landmarks that are going to be important in the next section for us to fully grasp the synergistic nature of the anatomy of the heart and the cardiac conduction system, and how we read that on the electrocardiogram. So let's go ahead and start doing that. In the next section, we're going to start in the right atrium, which is located right here. Okay, so that's the right atrium, and you'll learn more about that in the next section. The second thing we're going to be talking about is the tricuspid valve, which is located right here. So it's between the right atrium and the next section, which is the right ventricle. So this area right here is the right ventricle, which then is 3 pieces covered so far, and then we're going to be moving into the pulmonary valve, which is located right here. So moving up through the pulmonary valve. And I'm not even going to bother mentioning what this is because, again, I don't want to bog you down with a bunch of information. But eventually, blood goes out, and then we come back in here. And we come through here, and we're going to end up at the left atrium. So the left atrium is right here. And from that point on, again, we encounter another valve. And that valve is the bicuspid valve, which is also known as the mitral valve, but I'm trying to keep things within one name. A lot of these valves have several different names. We're just going to go with bicuspid valve, mainly because it kind of makes sense with tricuspid valve. This is the bicuspid valve. So that's the bicuspid valve, and then we end up in the left ventricle, which is right here. And then from there, the last spot is actually the aortic valve, which would go through here. And this artery is kind of covering it, but the aortic valve would be located somewhere in here, so inside the aorta, and blood would then move back out. That looks like a huge pile of scribbles. But if you followed along, hopefully you were able to follow along. That should give you some landmarks, and we're going to go over all these again in the next section, but tie everything together. So there's the introduction. There's an introduction to the anatomy of the heart, and that's what we're going to be using to explain the rest of this video. All right, let's move on. Okay, so for simplicity's sake, what we're going to end up doing is breaking this down into several different pieces, different steps. I like to do that for, well, really any sort of complex article / video because it makes things easier. Now, if you'll remember, I did mention the electrocardiogram, and the electrocardiogram is what is used to bridge between these two systems. So you've got your actual heart, the actual anatomy of the heart, the physical aspect of the heart, as well as this reading. And the electrocardiogram is able, without us actually looking at the heart, we're able to tell what stage of the pulse, what stage in a single pulse that the heart is in due to the electrocardiogram. And we're able to do that because it gives us a reading, and that reading looks like this. And I know it looks a little funky if you're completely unfamiliar with it, but by the end of the video you'll completely understand what each one of those bumps means and how it relates to the heart. So we're going to first focus on the P wave. So you can see this slight bump, and that's why it's called a wave, the P wave, and how that affects the heart. And this is where the cardiac conduction system actually comes in. I'm going to have to color code all this stuff, but let's just start out by looking at the heart over here. This is all inclusive in the P wave. So all in this little bump that the electrocardiogram is going to give us, we're gonna see in its physical state what happens in the heart. So the heart fills up with blood in, if you remember the landmarks, this is the right atrium. So in the right atrium, blood has filled up completely, and that's when a particular sensor, or, well, for lack of a better word, it's a sensor. It's really a bundle of specific cells called the sinoatrial node. And at the sinoatrial node, it senses that the right atrium is now full of blood, and as a result, it sends a signal. And that signal is supposed to tell the muscles around this area, around the right atrium, to contract. And it's going to do a few other things as well. So this signal gets sent out across here and across here, and it's going to end up at a point right there, which I'll discuss in the next step. But the signal goes across this right atrium, and from there what actually happens is the tricuspid valve opens. So there it is opening, and of course what's going to happen is the blood flows through here and fills up the right ventricle. So right atrium, tricuspid valve into the right ventricle. Now let's quick check this out again. So again, it doesn't just send a signal across the right atrium, but also sends a signal over here to the left atrium. And why would it do that? Well, anything that happens on the right side needs to happen on the left side to equate for the room that's going to be necessary for the heart's function. So in this case, it does that actually using something called the Bachmann bundles. So the Bachmann bundles are just a carrier system, a nervous system from the sinoatrial node over to the left atrium. Let me quick write that down. So as that signal moves across the Bachmann bundles, it affects the left atrium, and then of course the same thing is going to happen that happened on the right atrium. This, in this case, the bicuspid valve is going to open, allowing blood flow from the left atrium into the left ventricle. And that is all represented here in this P wave, which seems like a lot. Actually, quite a bit happens just in that one little bump, and that is all called atrial diastole. Okay, so we can move on to the next step. Okay, now this isn't exactly a specific step that a lot of people talk about, but I think it's important enough to quick mention. And this step is actually represented right here. So right after the P wave and right before the, what you'll soon know is the Q wave. And that flat line is actually a lull point, in a manner of speaking, that allows the blood to flow fully from the right atrium and the left atrium into their respective ventricles. So this signal is far too quick for it to send and blood to just get to pour in here that quickly. So what happens is there's still a little bit of blood in the right and left atrium, and because it needs a little bit more time to fully go into each ventricle, this node here, which is called the arterioventricular node, the AV node, actually slows down that signal. So before the next step, the signal, which if you'll remember in the last step, I talked about how the SA node sent its signal to two different locations. Well, one of those locations was a kind of mystery spot, which I didn't want to mention right then, but now, again, that SA node, which was located here, sent that signal to the AV node. And at the AV node, everything is kind of slowed down so that blood can fully go into each of the ventricles. That's all you need to know. It's kind of just a small step, but I think it's important enough to mention. Okay, so now we are at the second to last step, which is called the I'm labeling it as the QRS waves. So we're kind of grouping these three segments together because they are so closely related that one might just as well. And this causes ventricular depolarization. So we're talking about basically the activation of the ventricles, kind of like we had the activation of the atriums. So we're going to go ahead and first focus on the Q over here. So you'll see that it kind of dips down here. And this is kind of a small movement, but we have the valves that are still open at this point. And we have blood that has fully filled the ventricles, right? So the atriums are empty, the ventricles are full. And that was, again, all due because the signal was not stopped but slowed down at this AV node. So now with this Q wave, what happens is that the signal moves on from the AV node through the septum of the heart, so through this way. So this would be the septum right here, kind of like that middle portion that separates the right and left parts of the heart. And there's actually a new bundle here that's called the bundle of His. I don't know who named these things, but they're a little strange. Anyways, but that's called the bundle of His. Go ahead and write that. His. H-I-S. So not hers, but his. Haha. And all this does for the Q wave is actually we're talking about a closing of these valves. So these valves end up closing so that they aren't open, and the reason for that is because on this very next step, so the R and S waves, we're going to see the ventricles contract. And when that happens, you don't want the blood to then move back into the atrium. So you don't want that to happen. Okay, so you don't want this to happen. So in that case, this Q wave happens and the tricuspid and the bicuspid valves close again to then keep that blood in the ventricles. And because that happens, then the blood can then move out of the ventricles through the next opening. And that next opening is actually seen right here. So we talked about how there were different valves. Well, in this case, we're talking about the pulmonary valve for the right side. So, and I should quick mention, the right side, we're looking at things from an anatomical point of view. So you have to look at it from the opposite direction. I know that's a bit confusing to some of you, but that's the way scientists go about it. So it gives a universal point of agreement. So it's the anatomical point. So this would be the right side. This is the left side. So at this point, when we see a movement from the Q all the way up to this R, we're actually seeing a stimulation from the bundle of His into what's called the Purkinje fibers. Again, I don't know who named all these things, but that's what they're called, the Purkinje fibers. And the Purkinje fibers are going to are located in this kind of meaty area here, and they are going to activate the pretty powerful muscles, the muscles of the ventricles, to push inwards. Let me clear that up for you guys so that we can get a little bit clearer image here. Okay, so hopefully that's a little bit less of a mess, but just to reiterate, these yellow lines are the Purkinje fibers coming in. They've been activated, and they're going to activate the muscle, the myocytes that make up or around the left and right ventricles, and because of that, then you're going to have a contraction, and that contraction can be seen right here. So this massive spike is because the amount of contraction is much higher, so you're getting a bigger contraction, or you need a larger signal to contract these ventricles. And this R ventricle is actually representative, is a representative of the left ventricle, okay? And the S here is a representative of the right ventricle. So it might not be very noticeable, but the left ventricle actually contracts just a tiny bit earlier than the right ventricle, but they're almost the same at the same time, almost. So then you've got blood movement that goes through the aortic valve into the aorta from the left ventricle, and from the right ventricle we're moving in from the pulmonary valve, which has opened to allow blood into the pulmonary artery. And this whole process is called ventricular systole because pressure is being exerted, so you have that contraction up against the arteries and veins. So that's what creates that systole. Alrighty, so this step is pretty simple, pretty self-explanatory, but the T wave is a representation of the relaxation of the ventricles. So ventricular repolarization, if you will. And all that means is basically that everything resets. So when we had that contraction in the beginning, the ventricle pulled inwards, right? So it's pushing for the contraction. So imagine that this is all flesh, and it's been pushed in to then push blood outwards this way and outwards this way. And obviously it can't stay that way. So what it does is goes through this T wave, kind of a relaxation phase, and the ventricle wall then goes back to its normal position. And that is it. That is located right here, and then it keeps going until we have a filling of the atrium again. And as we know, once that happens, then we are right back at the P. So if you can imagine, this just extends, and it's just gonna extend back over here and start all over again. And that's it, just relaxation of the ventricles to then be in a position to then go through another heartbeat. So that's it, that's the whole video. If you would like to know more information, if you'd like to know maybe the speed at which this happens, if you'd like to know more of the details of exactly how step-by-step, little mini steps between everything, then of course check out the article that is linked below in the description box, as well as it will show up once the screen blacks out. And if you found any of this stuff informative, please subscribe to the channel, because that certainly gives me more motivation to keep coming out with this content for you guys. So that's it. Until next time, hopefully it was informative. Have a good one. See ya.